So we've now got David Gill, who is CFO of Juvenescence. Hi, David.
Hi.
Hi, good to see you.
Good to see you.
And also we have Martin Ducker, Martin, of course, how are you? Who is of Juvenescence Life. Donald had a presentation. So, gents, thank you.
Fabulous. Well, thank you, Master Investor, for hosting us here today. The theme is investing in the age of longevity, and it's my privilege to be here to tell you how we do that at Juvenescence. I'm the CFO at Juvenescence, and I was attracted over 3 years ago by the prospect of working with our 3 founders, who I'll tell you more about shortly, as well as the broad pipeline of assets that Juvenescence has. So I'm going to give you a 10-minute introduction to aging as a risk factor of chronic disease, what the opportunities are out there, and how Juvenescence is going after them. I'll then hand over to Martin, CSO, who's going to tell you a little bit about some of the programs that we're most excited about. Forward-looking statements. I was amazed to hear recently that in England, 1.5 million people, that's 5% of the workforce, are employed in adult social care, and the demand on them is only growing with an aging population. Clearly, we need to do something about this. And at Juvenescence, we take aging as the biggest risk factor to chronic disease, with a world-class management team across a broad portfolio of assets. Founded 5 years ago, Juvenescence has raised $246 million of capital to date. Our 3 founders are so convinced by it, they've put $55 million of their own money in and will commit to a post-IPO lockup. It was Jim, our chair, who wrote the book Investing in the Age of Longevity, Juvenescence, years ago before most others spotted this meta theme. And Greg, our CEO, in 2022, which has been a terrible year for capital markets, completed an $11.6 billion deal for his last company, Biohaven, with Pfizer in May. And he hopes Juvenescence is going to be his last big thing. Greg, by the way, lives and breathes longevity with a discipline to lifestyle and diet that, frankly, I can only aspire to. Lastly, we're lucky to have Dec Dugan as our Chief Medical Officer, former head of worldwide drug development at Pfizer, who has an uncanny knack for choosing the right drugs to develop. Managing partner at a biotech fund recently commented to us how broad and deep our pipeline is. Martin's going to tell you a bit more about some of the assets that we're most excited about shortly, including LyGenesis, which seeks to treat end-stage liver disease by using lymph nodes as mini bioreactors to grow new ectopic livers. This is biotech, so not everything is going to be successful. But by having 10 or 11 great assets, we need 1 or 2 of those to come good to deliver a great return for our investors. Aging is not currently recognized as a disease by the regulators, but it is the single biggest risk factor towards developing chronic disease. For example, smoking increases your risk of chronic disease by 5x. Aging from 20 to 70 by 1,000x. I went to the Longevity Forum event on Monday, and I heard Andy Haldane talk about how in the UK, 1/6 of the workforce now report long-term ill health. And workforce participation is declining, especially amongst over 50s. One more sobering statistic. In China, in 1950, there were 7.5 children under the age of 15 for every adult over 65. Today, that's fewer than 1.5. In 2050, forecast to be 0.5. The burden of all of this can't just fall on the young. Clearly, we need to do something about it. As the CFO, I know that companies need near-term prospects. The clinical and commercial opportunities are enormous, And sadly, the global market sizes and populations are only set to grow with increasingly aging populations. By the way, the market for Alzheimer's will be significantly more than $16 billion if someone discovers a truly viable treatment. So anti-aging is a big opportunity. By the way, the bank spotted this before most people, including Barclays, who's leading our Series C fundraise at the moment. Current solutions focus on individual diseases, but at Juvenescence we take a two-pronged approach. Firstly, to delay or prevent the onset of those diseases by intercepting the pathological processes of aging and preventing those diseases developing, helping people live healthily for longer. Secondly, we're going after the diseases themselves with our broad pipeline of assets. So our differentiator is that we go after the prevention of aging. We take scientific rigor not just to our JuvTherapeutic's pharmaceutical portfolio, but to our JuvLife natural products portfolio. And whilst an asset might take many years to get to a value inflection point through pharmaceuticals and JuvTherapeutics, sometimes it might make more commercial sense to develop it through JuvLife and achieve commercialization much earlier. So we take a strategic approach to risk management and revenue and maximizing returns. We take an opportunity through a rigorous set of filters and eventually assess whether it should be developed through JuvTherapeutics, ultimately seeking to out-license our pharmaceutical products to big pharma after a phase 2 trial, or through our JuvLife portfolio, seeking to earlier monetize through a partnership with a multinational consumer company. So lastly, before I hand over to Martin, so far we've had 2 successful exits, including in silico medicine, where we invested $8 million and exited with $31 million of cash. We're on the cusp of achieving multiple additional value inflection points over the coming 18 plus months, and that'll be unlocked with our Series C fundraise. Raising $150 million with a large check already committed, this fully funds all of our programs and more, including the LyGenesis trial I mentioned, which is commencing its phase 2 trials now, and hopefully should have readouts with the possibility of out-licensing as early as 2024. Our use of proceeds funds numerous clinical trials, additional JuvLife launches, and markets prevailing an IPO in the next 12 to 18 months, built around value inflection points. So with that, I'll thank you, and I'll hand over to Martin to tell you a bit more about some of our programs.
Thanks, David. As mentioned, I'm representing the CSO today. I've been at Juvenescence for about 4 years now and seen a number of waves of interest and investment come into both Juvenescence and the longevity field as a whole. Since the beginning, our general thesis has been much the same. We wanted to invest in things we could do immediately to help people live longer, healthier, things that we should be investing based on the quality of the science now and the regulatory framework that we all sit within. And then ultimately, what else should Juvenescence be doing as leaders in the field to really push forward the potential of longevity? That last category, we like to sort of talk about internally as transformative therapeutics. And these are, we have to accept they're really going to be the ones that we needed to fully realize the potential of the anti-aging field and the extension of health span and lifespan that we all see as possible. I have a lot of optimism in, we've talked about some of the organelle therapeutics today and partial reprogramming, but one of the things that we often see with these transformative therapeutics is the groups working on them really haven't understood the risks that they're taking on by taking on such a high level of technology risk. One of the things that we like to make sure we do when we look at these transformative therapeutics is that we're really able to fix the biology risk and invest in areas where the biology is so certain that ultimately you're only taking on an engineering risk at that stage. And LyGenesis was one of our first investments. Many of you will be familiar with it, and I think it's actually a really, really good example of this theme. So, high level, LyGenesis is a cell therapy being developed. It's actually in phase 2A clinical trials right now, enrolling patients as we speak for end-stage liver disease. This is a seriously high unmet medical need, with the only current treatment being liver transplant. And sadly, due to supply of transplant livers, donated livers being not keeping up with pace, dozens of people die every year waiting for their livers to become available to them. So what LyGenesis do is they take discarded donated livers. In the US, that's about 40% do not get used for transplantation, and they process them into individual liver cells and then engraft them into the lymph nodes surrounding the patient's liver. And then once the liver cells are in there, they then grow into functionally mini livers. If you process these mini livers and hand slides over to a pathologist, they look identical to that of a normal healthy liver. The important thing about this procedure is it's incredibly simple. It takes about 10 minutes by an endoscope, local anaesthetic, compared to the really quite extreme process of a liver transplantation. And this means that this treatment has a real kind of standalone effect compared to anything else that's currently available for these individuals. I mentioned earlier about the importance when selecting these technologies in having very, very clear understanding of the biology and having the technology risk being the only key one. And this was the data that we invested in back when we selected LyGenesis. And we've looked at these kind of Kaplan-Meier graphs here. And the key thing here is we've in the development of this therapeutic, it's been tested now in mice, rats, dogs, and pigs, hundreds of animals, and each one, despite having a very severe intervention that causes breakdown of the liver, all of them have survived in response to the LyGenesis treatment. And you'll see on the graph on the right there, the treatment with the liver cells completely restores liver function. And in the second theme being more traditional therapeutics, I just want to talk a little bit about these in the sense that one of the big mistakes that we see people make in the context of longevity investing is they forget that a longevity therapeutic is just a drug. And the regulators, the clinicians, the patients ultimately don't really care whether a drug reverses the epigenetic clock or may one day change kind of outcomes in terms of frailty measures. What they ultimately need to see is that the drug is effective at treating the pathology that are presented with there and then in the clinic. So therefore, when we select anything that comes through our shop, it's not just a matter of whether we're seeing interesting biology to do with aging. We also need to effectively look at this, and we're a team of pharmaceutical scientists who effectively develop any product that we look at as if it is a traditional pharmaceutical development. I've highlighted MDI Therapeutics as a good example here. So this is a company developing small molecules against a molecular target called PI1. PI1 has some really interesting longevity data. It's one of the key SAS factors, so the inflammatory signals released by senescent cells. In many of the protein aging clocks, it's one of the proteins used to correlate with age. As well, there's actually human genetic data. This is data from the Amish community in Indiana, and a partial knockdown of the PI1 gene both protects against cardiovascular disease as well as increasing the life expectancy of those individuals compared to their peers by around about 8 years. But the key thing for us is not simply the longevity data, but the strong association with the disease. So PI1 is upregulated in metabolic disease, thrombotic disease, and our first interest, which is fibrosis. So in lung fibrosis, which is the indication we're going to be going into, the PI1 is highly expressed. We have data suggesting that it's one of the key drivers of the senescence you see in the older lung, making people particularly susceptible to fibrosis. Moreover, when looked in the preclinical models, the gold standard rodent models as well as human cell data, both genetic knockdown as well as pharmacological inhibition is able to not just prevent but therapeutically reverse the fibrosis. MDI have small molecules developed. We've validated them. We believe they're best in class. These have gone through IND-enabling studies, and we hope to be in the clinic at the latter part of 2023. And the third theme I just want to talk about in terms of selecting compounds is actually, we have to accept that the longevity field is relatively nascent. We heard earlier it's been going since the 90s, but really investment's only been coming into this field in the last sort of 10 years or so. What you'll find is there's some really compelling data, but just the execution is not quite there just yet. So what you have to make sure is that you don't commit too heavily to a particular mechanism or to a technology such that you're not able to move nimbly. This is a good example from the Juvenescence pipeline to show what I mean by that. And if you roll back the clock to about 4 years ago, we were looking for interventions that could change the trajectory of aging in humans, make people healthier. And at the time, the only, we now know it to be, it's still the same. The only kind of well-trodden path is dietary. You have calorie restriction, intermittent fasting, ketogenic diet are the only interventions that routinely are presented to increase health. The commonality across all of those is an increase in the ketone body, beta-hydroxybutyrate. This is a compound released by your liver from fat stores, which serves as an alternative source of energy to glucose, primarily fit to keep your heart and your brain functioning. At the time, we also knew that it had a role in oxidative stress and in cardiac function, and it had a long history in childhood epilepsy. And our collaborators from the Buck brought to us a series of compounds which they had been able to show were able to increase beta-hydroxybutyrate levels rapidly and safely in preclinical models, but we couldn't, at the time, identify a clear clinical intervention for them. So we were able to nimbly and creatively use these as the basis for what became our consumer division. And if any of you have tried our first product, Metabolic Switch, that's what those compounds became. They latter became the basis of our PET division, JuvPET, and we've recently completed our first tolerability study in pets, looking to expand into that market next. Roll forward to today, and in the interim, thanks to the clinical work we've done with Metabolic Switch, we now have answered many of the outstanding pharmacological and mechanistic challenges we had with with the first generation esters, and this has evolved into Selah Therapeutics, a new collaboration with the Buck Institute to develop a new series of compounds with more precise pharmacology for clinical applications. The first application is heart failure, specifically for individuals with preserved ejection fraction, but there's no reason why these can't be used in other heart failure patients. And just to remind the audience, this is still the #1 cause of hospitalization in those over 65, with 1 million cases in the US alone reported every year. Again, key pharmacology was important for us. This is proof of concept data of an IV infusion of beta-hydroxybutyrate. It shows in heart failure patients you get a rapid increase in cardiac output. What you'll also see is a dose response on the graph on the right, but what you'll also see is in the graph on the left, as soon as the IV infusion is stopped, the cardiac output starts to drop. So what our medicinal chemists are doing right now is to develop the novel compounds with a constant level of beta-hydroxybutyrate, so you don't get these fluctuations in output. Finally, I just want to spend a couple of minutes on our consumer division. As David said, we have we're proud of our deep portfolio and see the consumer part as an essential part of that. And fundamentally, this is down to We want to do things now. And if you look at the kind of geroprotector space and think about the molecules people think about there, they're kind of metformin, statins, beta blockers. They're all simple, small molecules. But if you look at the investment in biotech over the last few years, between 2019 and 2021, of the 40 billion invested in biotech, only about 500 million has gone into small molecules. So if you think about this as a supply chain, if you roll forward to 5-10 years when that group of investments have matured, we're going to not have any of the small molecule geroprotectors that people are talking about. So if we believe in that model, we need to find an alternative way to supply them, and that is what our consumer business is. I don't have time to go through all of these today, but these are the products we're working on. As Kristen talked about earlier, the amazing thing right now is we've got beautiful ways of studying metabolism and look at thousands of different molecules that are bioactive in the body, and then use statistical methods to see whether they're causative. Where vitamins are essential during development, we believe they are equally essential molecules during specific aging and health situations later on in life. And we're currently going through and identifying and validating them. The most obvious example for us within this group here is longevity lipids. I can't specify the exact lipid here, but we analysed about 1,000 lipids over your life and identified some key lipids which are rapidly decline during age by about 40% in some tissues. These are essential for the cell membrane construction and how cells signal to each other. So rapid decline is correlated not only with death, but also the onset of many chronic diseases, diabetes, cardiovascular disease, and dementia. You can't supplement them directly because they don't get past the gut, but we've identified some novel precursors which rapidly do, at low dose, elevate the level of these back to a youthful level. We're currently setting up manufacturing through synthetic biology approaches in yeast, and we hope to get on market after going through regulations in about 18 months to 2 years. So I'll wrap up there. Thank you very much for listening. If you do want to hear more about Juvenescence, that's our website. You can also purchase Metabolic Switch, the first iteration of it, now online, and our email address is there. You can reach out to me or David. Thank you.
Great.